Hi, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about urgent care do's and don'ts. Children get sick at the most inconvenient times, and sometimes your pediatrician may not be able to see them. The urgent care is right down the road. Can you take them there? Should you be taking them to the ER? What's the difference? Well, these are the questions we're going to be chatting about, and it's really important for you to know what care is going to be offered at each of these locations that are not your pediatrician and when to know where to go. As I mentioned, urgent cares are everywhere, and just because it might be convenient to go to them, it's really important to know that convenient care does not always equal good care. That is so important to know. Just because there's an urgent care here doesn't mean that they know all the same nuances of your child the way your pediatrician does. And you as the parent are the link there in terms of knowing your child and knowing your child's medical history. And that doesn't mean to say that urgent cares are bad. It just means that not all urgent cares are created equal. Not all of them are trained to be able to see pediatric patients. I recommend, as a parent, calling ahead and asking a few important questions. First off, do they see pediatric patients? Many urgent cares may not be comfortable seeing children 5 and younger or 2 and younger, so it's really important to know. Others may not offer things like labs or imaging. Not all urgent cares have imaging modalities, so if your child hurts their ankle and you want to take them in for an x-ray, it's probably worth calling to make sure that they actually have x-ray modalities. Second thing, please do not consider urgent cares to be the equivalent of ERs. ERs are trained facilities to be able to combat and take care of any kind of trauma or emergency that comes in. Urgent cares may not be the same. Urgent cares are not the same. Just like we talked about imaging and labs, you also have to think about things like IV placement. Being able to see a very sick child and resuscitate them to the point that they are hopefully feeling better. Some urgent cares may not have the trained personnel to be able to do that, to put an IV in a pediatric patient, to catheterize a pediatric patient and get urine. In that case, you might want to double check ahead of time because it may save you time to just go straight to the ER if that's the case. It might be the middle of the night, your child is vomiting, and your urgent care is potentially going to be open till midnight. Or should you be going to the ER because they don't see pediatric patients at the urgent care? These are really important things to know about around the urgent cares near you. Now, on that note, please consider that if you do not have the time to call and find out these questions ahead of time because the problem is so severe or worsening, that might be indication enough for you to go to the ER. You see, urgent is very different than life-threatening. So what warrants an ER visit versus urgent care? Well, I wouldn't even know where to start. There's so many. The entire pediatric residency teaches you kind of how to identify an emergency in a pediatric patient. So it's very hard to know. I will list a few things here that will indicate more of what's an emergency in a child versus something that's an urgent need. We don't expect you as parents to know that. That's what your board certified pediatrician is for. So even if it's the middle of the night, or maybe it's getting close to nighttime and you really don't know, or it's the weekend and your pediatrician's office is closed, you can still call us. Oftentimes pediatric practices do have on-call services, and a doctor should be able to get back to you, be able to triage you and talk you through some really perhaps weird sounding questions like, did they cry right after they fell? Is there any swelling or discoloring around the eyes? These weird questions that we might be asking you that actually help us triage how ill your child is and how quickly they need to be seen and what level of care they need to be seen at. Now, if your gut feeling goes against what the pediatrician advises, don't ignore it. That's really important. Parental intuition is very important, and I highly recommend you follow your gut. Now, here's a really important tip. Please don't use urgent cares to address chronic problems. So I'm going to paint you a picture. Your child's had a cough for a month. You've seen the pediatrician, and it's at 4 weeks and it's still not getting better. So you decide to go to the urgent care. Please don't do that. This is something your pediatrician wants to know. It could be anything from a habit cough to a foreign body to possibly asthma. And when you're seeing somebody for a snapshot piece of time, it's very tough to determine those things. But your pediatrician has a little bit of a more longer health record and perspective of your child and your child's medical health. So we're able to really address those chronic problems a little bit better than an urgent care is. Specifically, if this cough, let's say, wasn't worsening on a random Saturday morning. So I wouldn't just decide, like, let me go and try to get this problem addressed by somebody else. Now, of course, if the cough is worsening, your child all of a sudden develops labored breathing and it's the weekend, and that cough was there before, and now it's all of a sudden a little bit different. that is something that you would probably want to go get checked out for. On that note, don't use urgent cares as a second opinion or trying to fact check your pediatrician. It's really not going to be that helpful for you, because let me tell you something. If you take your car to a body shop before you go on a trip and the tires all look good and they have tons of air, and then we say you're good to go on the trip, and then 2 days down the road your car develops a flat tire and you take them to another body shop, that doesn't mean that the first one was wrong. It just means that the picture of your car has changed. Their tire health has changed, and that's kind of the exact same thing. So if you go to the pediatrician and we say it's a cold, or there's nothing wrong right now, or the ears look good, 3 days later something else might develop. Exams change, the infection might evolve, and just because they see an ear infection at the urgent care or they diagnose an pneumonia at the urgent care doesn't mean that that was missed by your pediatrician. So please don't consider that urgent cares are a second opinion. It's a different exam. The status has evolved, and that's really helpful to know as a parent, I think, and as a pediatrician that I'd want my parents to know. Lastly, this started out as a do's and don'ts, and it might feel like I've been saying don't, but here's the really important do. Do follow up with your primary care doctor for your child. So your pediatrician needs to be kept in the loop. This is really important. I don't want to hear at the next year's well check that, by the way, we went to urgent care 4 times. We never got any of those notes. It's really important for us to know that they've been going 4 times, being seen for a cough, and gotten maybe steroids 4 times. That's very important information, especially when we're managing the overall health of the child. While urgent cares have really changed the accessibility of medicine, they have definitely not replaced your primary care pediatrician. So I hope this video was helpful. If you have questions below, make sure you ask them. If it was a helpful video, give it a thumbs up, and make sure you tune in next week for the next video. Bye.